Dr. Reddy.
Dear brothers and sisters, good morning. Greetings of love, joy, and peace to all of you. On behalf of Sathya Sai International Organization, I extend a warm and hearty welcome to each and every one of you. It probably is not only warm, but hot. So here right now, this weekend has been a very hot weekend here. So I appreciate the commitment and contribution of every one of you towards this medical conference. And I'm happy to say there are delegates from 22 countries, from 6 continents, South America, North America, the Europe, the Africa, Asia, and Australia assembled here to participate in this conference. As Venkat said, thank you for your kind words, Venkat. Hope I justify to that. So these people have committed decades of their life towards the delivery of this ideal healthcare. And also unique this particular time, this conference, I'm very happy to see that about 150 young physicians are participating in this, interested in the loving and compassionate healthcare. And as you can see, another unique thing is more than 50% of the delegates are women physicians and women healthcare professionals. So show their important role in this mission. This particular conference, like most of you belong to the professional societies, distinguished in your, I know there are chairmen of the departments in different fields I have seen here. Here is a neurosurgeon, cardiac surgeon, all fields. We usually in our professional society meetings, we talk about the recent developments in diagnosis, treatment, and the recent technology. Or in some of the conferences now, they talk about the business aspects of medicine, how to conduct practice, ICD codes, CPT codes, MRI, all that. But this particular conference is not that. This is about loving and compassionate care. So here we are not going to talk about cutting-edge technology or the functional MRIs, PET scans, or genomics, or genetic engineering, gene mapping. Just we are going to talk simply about loving and compassionate healthcare. That is universal for all of us, whether you are a physician assistant, whether you're a dentist, or a neurosurgeon, cardiac surgeon, providing loving and compassionate healthcare is important. And we talked about this conference, it is ideal healthcare. What is ideal about it? What do we understand by ideal healthcare? The principles we have in this ideal healthcare is first, free healthcare, because most of the people cannot afford healthcare because of the cost. And you know, in this country, the most affluent, how we have seen, so many people do not have access. So to provide free healthcare. Second thing, it should be universal healthcare. Healthcare should be accessible to all people. And third aspect is, it should be a comprehensive healthcare. That means you take care not only of the body, because most of our treatment is focused on the body, but also on the mind and the spirit. And the World Health Organization has given the definition. Good health is total well-being, physical, mental, and social well-being, not merely the absence of disease or infirmity. So really we want a total good health. That is the comprehensive health care. So we are not only talking about the body, but the mental well-being. We have workshops on the mental health and also our spiritual well-being. And fourth thing is state-of-the-art health care. As beautifully said, because you are delivering the health care to the poor, the health care should not be poor. It should be really a good health care. And finally, the most important is delivery of the health care with love and compassion. And so this is the ideal healthcare principles. But we call this not only ideal healthcare. You may be wondering, why do you call Sathya Sai ideal healthcare? Because he is the source, he is the inspiration and guide for us to practice these principles. Most of you know, some of you may not know who Sathya Sai is. I came here not to talk about Sathya Sai because he told his followers, don't talk about me. Practice my teachings and do my good work. That is what is your duty. Not talk about me. Because who am I to know my words fail? But one thing I can do, it is my duty, is an embodiment of love. His life, his message, his ideals, his humanitarian works can all be enshrined in one word, love. He is the source of love. Love, as beautifully the music offering said, two things. The whole thing is about love. Love is the source, love is the path, and love is the goal. And also it is about the healing, because as I said, in our professions, we emphasize so much on science and technology, we forget about the art of healing, because we are as much scientists as we are the healers. So we need to remember about the healing aspect of medicine. That is the very important art of healing. That is what he came to emphasize us. And I want to briefly mention about his works. He was born in a remote village in India called Puttaparthi. So his love knows no boundaries, transcend all nations, races, religions, ethnicity. His love encompasses all. So he saw in this village, there was no primary school. People had to walk miles to get their primary school education. So he started a primary school which has now blossomed into a university where from primary to doctoral education is given completely free of cost. And the uniqueness about this, the education system is, it's not only academic excellence, but the end of education is character, emphasis on character. So this integral education he has introduced. Inspired by this, all over the world, more than 30 countries, we have education institutions, such schools, which provide this kind of integral education, where the emphasis is not only on secular education, but also on spiritual, where the emphasis is on character development. And also, he saw in this remote village, people have to walk miles to get drinking water. So he was moved by this. So he had a little well for the villagers. But then it bloomed, it blossomed into a massive project, water project, where the water is provided to millions of people in different parts of India. That is his love. We call that elixir of life. Inspired by this, the Sathya Sai International Organization, and we have presence for people who do not know, more than 120 countries. And we have got these water projects in different parts of the world. We have in Indonesia, I visited that Yogyakarta. We have in Nepal, the people we have people from Nepal are here. And we have in Sri Lanka, we have in Africa, and we have even in El Salvador. So all these places, we have different places wherever we want, basic necessity of providing the water. This is second thing he started. Third thing he saw was when people needed a healthcare, simple first aid, they have to go miles together. So he started a little hospital, which was only a 2-bedded hospital that blossomed into a 100-bedded hospital providing primary care. Then that blossomed into a huge system wherein we have got Sathya Sai Institute of Higher Medical Sciences in Prasanthi Nilayam, as you can see those beautiful buildings. And in Whitefield, we call those temples of healing, where not only you get the physical treatment, but you get that joy and peace. That is where we go into a hospital, you should have that feeling of calm and peace. That's what these things were provided. So primary to the tertiary medical care is completely provided free of cost in these places. The uniqueness about these institutions is only institutions where there is no billing department. I don't know any other institution where there's no billing department. No billing departments in these institutions. And cardiac surgery, neurosurgery, which many people cannot afford, is completely provided free. Actually, Dr. Neelam Desai will be talking about it during her talks about, she's a cardiac surgeon, how that is provided in these institutions. So inspired by this, have started the global health mission through various mechanisms, like the medical camps we have around the world. In more than 30 countries, thousands of camps. For your information, millions of patients were provided free health care through these things. And we have permanent medical clinics. And we also have mobile clinics. So the interesting thing is, people sometimes, we are providing the primary to tertiary care in the institution, but people cannot go there because they cannot afford the cost, they have no transportation things. And sometimes people are scared, particularly in remote parts of villages in India and some other parts of the world. If they have to travel, they lose their daily wages, they lose their daily earnings. So keeping that in mind, wonderful is the vision of Sathya Sai Baba. He started a mobile hospital in this remote village, where the healthcare professionals go to the remote parts of India, remote villages, and provide the health care. They do the preliminary diagnosis and treatment. And also inspired by that, Sathya Sai International Organization, we have these facilities in Nepal, we have the mobile clinic in Indonesia, we have mobile clinic in Sri Lanka, different parts of the world where we are outreaching to the remote parts and remote villages. And also another unique thing is we started now telehealth, because some people may not be even able to go to those places. Through telehealth, telemedicine, we are able to reach these people. So this is serving two purposes. One is to give consultation and treatment to the patients who cannot come to these institutions. And second is also education of the healthcare professionals. So these are the various ways which we are trying to practice. First we have the principles, and now how do you practice that? But most important is, every one of us who is involved in the healthcare profession, we have to practice in our daily life, in our own office, in our place of hospital setting. That is more important. These medical camps, clinics, institutions may not be there all the time, but every day we are having interaction with our patients. So it is this ideal healthcare principles we need to practice in our every daily practice in our office and in our hospital setting. And we have many dedicated healthcare professionals here who have been doing that. We heard of the famous physicians, William Osler, Albert Schweitzer, Jenner, Forsman, who did his own cardiac cath through a Foley catheter. There are many people who sacrificed. And let me tell you, amongst here, there are many of you who sacrificed many years serving the humanity. Like, for example, here Dr. Kalpalata Guntupalli is there. She is from Texas. All of you know there is Hurricane Harvey, and he has caused devastation. And she worked day and night providing care to the people in that critical care unit. And amazing, in spite of all that, she took the first flight possible. Yesterday she flew here to be part of the conference. Really, I congratulate you for this, your commitment. And I have many people like Dr. Mohan sitting here. He will be one of the speakers this morning. He conducted more than 2,000 medical camps providing care for diabetics and other illnesses in remote villages in India. And Dr. Neelam Desai, she will be also the speaker this morning. She is the head of the cardiothoracic surgery department in Sathya Sai Institute of Higher Medical Sciences, Prasanthi ground. She has dedicated more than 25 years of her life, the prime life, only one place. She stuck to the institute and provided more than 7,000 surgeries, and also providing people, the children, congenital heart disease, all kinds of illness. She will be showing, I don't want to take part of her talk, how she has dedicated her life for the suffering humanity and the needy people. and sits here in front, Dr. Narendranath, the great neurosurgeon. We have many neurosurgeons, but he is unique. But he's from Australia. He got special awards, which will be mentioned later on. But main thing is, in the island of Fiji, there was not one single neurosurgeon. Year after year, he and his team went to Fiji to provide the neurosurgical services completely free of charge to the people. And not only that, he tried to train the local healthcare professionals. This is Dr. Narendranath. Like that, we have many, I can't go on telling. There are doctors here who go to the various medical camps in Russia, in Guyana. Like, for example, I can see one of the doctors here, they do the fibroid camps for the people in Guyana. They were waiting for 10 years. Their fibroids were as big as like a fetus, 10 to 15 pounds. These people are waiting. So these healthcare professionals from USA went there, provided gynecological surgery. Like that, we have many people who have that commitment. But important, as I said, is practice of loving and compassionate care in our daily practice. And what did I learn? I want to tell you in my daily practice, what did I learn and continue to learn? Because life is about continuous learning. First thing I learned is listen. This doesn't apply not only healthcare professional, for everybody in life. Now, somebody is talking, before somebody finishes sentence, somebody talks. First they said, doctor has to listen to the patient, and patient has to listen to the doctor. That problem, we have surveys, many surveys which showed that problem is really a big defect in the healthcare profession now. That is why liability issues, mutual trust between doctor and patient is declining. So just without interruption, they said, just listen to the patient for 3 minutes. That is the greatest service. And same thing with the patients too. I have patients, I practice diabetes, I tell them increase the insulin thing and DC, stop in the evening, and they don't remember. Then again they go to the receptionist, ask, what did he say? That is why not only I tell verbally, but I write it also, and I tell the nurse to repeat that. So this listening is important. And also we need to listen to the patients. Sometimes they may have intuitive feeling. As a scientist, we may know what is right, but the patients have the intuitive feeling. I can tell you one instance. This happened about 20 years ago. I had a patient who had a gallbladder acute cholecystitis. It was almost gangrenous cholecystitis. So the patient needed emergency surgery. So she had a lab colleague. This is one of the best surgeons in our town. He did it. He did many. But that patient, so he wrote a discharge order. He did the surgery that evening. He wrote a discharge order. The patient says, oh, I went to see as a medical consultant. She says, Dr. Reddy, I don't want to go home. I have so much pain. Then I overruled this doctor. I said, cancel the discharge. Let her stay. Next morning, we go, and again he said, oh, these people exaggerate pain, Dr. Reddy, let her go home. Again, she says, so much pain. She's my patient for 20 years. I again canceled the order. And then next day, evening, I told, there's something wrong. Please look into that. Then he listened and he was shocked. He thinks this lady's gallbladder has perforated. He has a massive peritonitis and she has shock. So to show that when patients say something, we need to listen. There is something there. Just don't ignore because we know. And another instance happened about listening. I had a patient. She had a mass in her abdomen in the CAT scan. And then we wanted to do surgery, obviously. And 3 days before the surgery, the patient said, I don't feel anything. So doctor, please repeat the CAT scan. He says, no, you have an obvious evidence tumor. Why do you want to waste money doing another CAT scan? So he is a surgeon, so I kept quiet. Then he opened the abdomen, there was no mass. So this is a lesson we do. Still it is a mystery how it disappeared, but just we need to listen to the people. That is very important. Listen. Second thing is loving and effective communication. As I said, Swami says, loving words, like in our practice, we just a word of love, kind words make a big difference for people. Just we see, that's why they say the good doctor is the one who treats the disease. But the best doctor one is the one who treats the patient with the disease. Think of the total patient. We forget, we focus so much on the disease differential diagnosis, but we need to think about the total patient care. I remember this I often use in my practice. Patient was very much upset with family issues, her health problems. So usually her blood pressure is normal. That day her blood pressure was high, 160 over 100. So instead of starting medicine, I said, she told all the problems. I said, don't worry, be happy, sing the song, don't worry, be happy, and come back in 2 weeks. She came back in 2 weeks. And I checked her blood pressure. It was 130 over 80. And I told her, you see, you said, don't worry, be happy. And she was so cute. So just next day, she came to my office, brought a bass fish, which you press the button, it sings this Bob Marley song, don't worry, be happy. It sings that song. So how it made an impact on people just in word. Then even just I saw her last week, she said, Dr. Reddy, this is my thing. I tell everybody, my family, friends, whenever they worry, don't worry, be happy. So we need to just practice that, just that effective and loving communication. That is very, very important. And third thing is, we need to be an exemplar. Anything in life, as a teacher, the disciple you want to follow, should be a good exemplar. Same thing as a doctor. Whenever patients come from different offices, I ask, why did you come to see me? They say, oh, the doctor himself is so big and he tells me to lose weight. So first you need to be a good example. So then he says, another patient, that interesting things we learn each time. Why? Oh, the doctor, oh my God, his tie, there is so much food particles, dirty, and she doesn't even take care. And each one, they feel. So we need to be an example what we are preaching about. And third thing is, most important, we should be happy. That's why it says, happy doctor, like they say, happy wife, happy life, people say, but happy doctor, happy patients. So we need to be very, very happy and show that joy. We need to radiate the joy for people around us. Then they feel it. So this is very important. Just they said, not have a long face. That is why some of my patients, when they go to some offices, not often surgeon, particularly some surgeon, they say the doctor is too serious and the office staff are also that. But you need to have that feeling where people feel empathy, feel like you are like your own kith and kin. In our office, we tell our staff, just treat your patients as your own family members. If they're old people, like you are your parents or uncles and aunts. If they're same age, as like your brothers and sisters. If they are younger than you, treat them like your nieces or children or daughters or sons. If you have that attitude, we will have that empathy. It's very important. Another thing is when we are with a patient, another thing which helps me is being mindful. When I am with that particular patient, once I close the door, that's all exists in me and my patient. Nothing else. Otherwise, sometimes we carry the emotions of feelings of previous patients. I used to do that mistake. And then the doctor, they think there's something wrong with them. So, doctor, why you are serious? My problem? No, nothing else. I was thinking about the other patient. Then I explained to them. So just live in the moment, be mindful. Another beautiful thing, important is spirituality in healthcare. So sometimes we don't want, let me tell you, everybody is spiritual. We all want to practice human values. Everybody wants love. There is nobody, whether you believe in God, not God, we are all embodiments of love. Everyone loves themselves, they love their family, friends, or work. Love is the underlying principle of everything. So you can talk about spiritual principles. I have so many patients who are Christians. I have 10 Bibles in my office. But each patient thinks I'm Christian, they come and give me a Bible. Jehovah Witness, this, that. So just bring spirituality, spiritual principles. And people think Buddhist patients, Christian, Jewish, they don't even know that what kind of religion. So they invite me to their spiritual things. So it is important to include spirituality in our health practice. If we do that, then whatever we do, we have joy in the service we do. I want to show these two slides where how it is not only we are giving joy to others. Actually, when we are coming up, they were telling how to strengthen spiritual life, that we are blessed and we share the blessings with the others. Similarly, we are happy and share that joy. So here, I was in Haiti. It was 2010. They had major earthquake, the damage done. We did a lot of relief work. You can see that medical camps being done. For many years, we did almost 5 years. And then bottom picture is the one where I went to visit an orphanage. So this orphanage, we were giving some toys, books, and then I said, do you want ice cream? They said, yes, we want ice cream. I said, get them ice cream. So I told one of the volunteers, to get an ice cream for those kids, here we throw in big gallons in the garbage. It took 40 minutes to find a nearby ice cream place. And then we gave to these people. That's the blissful life moment of my life. Once they were jumping up and down, they were kissing my hands, going around, dancing. So more than them, I had that wonderful joy. That is the joy of service. When you give there, when so many people around you are so much happy, simply giving little ice cream for the needy people, you gave joy to them and you are joyful. Next one. And then this happened in Philippines, you know that typhoon hand. So when there was a major disaster, so we were there, and then we did a lot of relief work for the schools and medical. And then we found in this particular area, Dr. Ravindran is here, these women, mothers, were having children in unsterile conditions almost at the roadside. We recognized the need, and they started a small maternity clinic. We started there, and we can see the mayor of the town and the women, they were almost in tears. Just we provided a simple place for women to have children in the sterile conditions. So all this wonderful work is going around the world, and we have this exhibition where we have the wonderful work being demonstrated in all these areas. Please go and enjoy during the exhibition and the workshop. Finally, I want to end my talk. Just happened a few days ago, as if I got that message. One of my patients, he belonged to the Church of Nazarene, and he went to Brazil about 60 years ago as a missionary. And that time, he's an English speaking, he speaks only English, no Portuguese, so he has to learn Portuguese. And in the church, he had only 12 people, he said. So he went on, and he was discouraged, and he was learning. By the way, he stayed there 22 years. By the time he left, it's 50,000 people. Then he says, after a few years, he was very discouraged, and suddenly he heard these words. This is from Galatians 6:9. He says, do not lose heart in doing good, for in due time the rewards will come. We reap the benefits if we do not get weary. That means we need to have that perseverance and that commitment, that conviction to say, we do good work, things will happen. It may take time, it will happen. Now, after 50 years, they invited him to go back because he did the serve. Do you know how many people? Now he has 150,000 people in that thing. It started with 12. That is the beauty. So you have that commitment, conviction, human effort, divine grace. Let us all work together in this wonderful divine mission and helping the needy around the world. Thank you for your kind attention. Jai Sai Ram.